Complex regional pain syndrome, they get seen before the pain specialist. They normally known previously as causalgia or reflexive sympathetic dystrophy. It's usually characterized by disabling pain, swelling, vasomotor instability, pseudomotor sweating abnormalities, as well as impairment of the motor function, and may be associated with psychological dysfunction. The diagnosis usually is based on history and clinical examination, so it's a clinical diagnosis. There's type A, type 2. Type 2 is usually with a definable nerve injury, so you have to define a true nerve injury which is present, and that's the difference between it and between type 1. Although there's significant development in the disease understanding of the pathophysiology of the disease, the clinical course is still quite unpredictable, unclear in terms of the treatment. Treatment usually likely to involve multidisciplinary team, like physical therapy and psychological modalities. You have to guide by the pain severity as well as the presence or absence of sympathetic dysfunction. Initially, the pain usually in the treatment of the CRPS or complex regional pain syndrome, you need to control the pain. You need to go aggressive with the physiotherapy to control the pain. Use tetracyclic antidepressant, gabapentin, opioids, or topical capsaicin, for example, or topical lidocaine or lidocaine patches. Secondary cases, the diagnosis with the use of sympathetic blocks, series of somatic blocks like IV alpha agonist infusions to the limb, IVRA, and physiotherapy as well. Psychotherapy is important, and neuromodulation with the use of spinal cord stimulator and CRPS type 2, as well as maybe the use of intrathecal baclofen.